Hi, my name is Imran and I'm a doctor working in the NHS. Here's a really quick guide to answer questions about the NHS crisis. What's actually going to happen? Is the NHS really going to break, or is it all fake news? Oh fuck. Yeah, there kind of is, but this time it's gotten ridiculous. Over the last few weeks, reports from across the country show the worst waiting times in A&E for over a decade. Patients left for hours on trolleys. Vital cancer operations being cancelled. 66 hospital trusts declaring major alerts and 20 black alerts, which sounds as bad as you think. The Red Cross even called it a humanitarian crisis in the making. December 27th, 2016 was the busiest day in the NHS history. I remember, I was on call. God, the patients are crawling through the windows! The term bed blocking probably sums up what's going on quite well. Patients admitted to hospital end up staying in hospital longer than they need to because the deep cuts of social care means there is nowhere for them to go. That causes a ripple effect, meaning ambulance staff queue in corridors for hours to get their patients seen in A&E. More and more people are also coming to hospitals. People making unnecessary trips to a heaving A&E department doesn't really help either. Psst. What? Oh god, this guy's in charge. The underlying cause of the NHS's problems is relatively straightforward. Demand is going up at about 5% a year, as are costs at about 7% a year, mainly due to medical advances, but funding just hasn't kept pace. In fact, if demand grows even in line with government forecasts, the NHS will face a shortfall in actual funding of about 20 billion by 2020. But that's cool. We've got Brexit to save the day. That 350 million a week will come in so handy. Thank God we voted leave, right? Right?
The £350 million a week we send to the EU, which we will no longer send to the EU, can you guarantee that's going to go to the NHS?
No, I can't, and I would never have made that claim.
There's also nowhere to put patients. In 1987, there were about 297,000 beds available in England. By 2015, this number was just 130,000, it's a drop of about 56%. In 2014, the UK had 273 hospital beds per 100,000 population. Now compare this to Germany and even Greece, and one immediately begins to realise the absolute unremitting pressure on the system has become so bad that I've even had to cancel urgent operations because there's simply nowhere to put my patient after I've operated on them. Not quite. The NHS is also dramatically understaffed. There's a massive shortage in doctors, nurses, paramedics and many others. The government says it's going to train 5,000 extra doctors, but man, I've been in medical training for 13 years and I'm still 2 years from becoming a consultant surgeon. So don't hold your breath, because by the time there's 5,000 doctors are ready, the NHS have probably been taken over by something like Virgin Health, who can't even get the toilets on your train to work. Perhaps nothing at all. If the government feels things remain politically stable, the NHS will probably continue to decline with poorer standards of treatment, whilst those who can afford it go private for the healthcare. Alternatively, the government may opt for more funding, whether in the form of general taxation, the so-called health tax, or co-payments such as charging those who can afford to pay for GP visits, like with NHS dentists. A radical route would be to move to a social insurance model like those in Germany and the Netherlands. Private providers are brought in, and everyone is obliged to buy health insurance with the state covering those who can't afford it. The problem with this is that how will you convince private companies to take over loss-making areas such as A&E and elderly medicine? Private companies will just take the bits that make them money and leave the loss-making areas where the real problems are to get worse, and we end up with something like in the US. Whilst all this dilly-dallying happens, it's only the frailest and the sickest that are dying in our hospitals and in our communities. They're not dying in the streets like in poorer countries, so we don't notice. But if the NHS is working properly, they'll be dying in less pain, less anguish, or perhaps not even dying at all. If you have any more questions, please feel free to put them in the comments below, and I'll try and answer them.